Well, joining me in the studio, we've got David Ashford. We've been doing the election interview, so we can park that to one side. Although I just say you are a candidate, just make that absolutely clear, for Douglas North. Well, I don't even know where to begin because we haven't had a catch up for a fair few weeks with everything going on. Things are still very polarised here. You went to the PAG meeting the other day and you were having some interesting moments from what I've seen on the videos. Was that representative of the whole night, by the way? Because just to explain, you had somebody who's come up and saying there's magnetic stuff in.
No, it wasn't representative of the whole night. Right. It was you'll have seen from the clip. It was a portion of the meeting where some people with very strong views expressed those views.
These are anti-vaxxers,
the positive, some were. I don't know if the entire group were. I know there's some that were. Right. But the audience as a whole, I thought, was a very well balanced audience. It was a very good night. I enjoy public meetings, and I enjoyed that one. And I thought there were some very, very good questions asked. So I wouldn't want people to categorise that entire meeting by that short video clip that's gone out. I thought it was very well run by the Positive Action Group, very well chaired by them, and I thought it was an excellent public meeting.
Well, let me put a question to you. This is interesting. I can ask you, what were the big questions at that meeting then? I mean, because we do things over and over again. Everyone's accusing us of doing things. Was there any fresh lines of questioning there?
So a lot of it was the repeats. It was people expressing concerns. The general view from the meeting seemed to be that they were happy that restrictions had been started to be lifted. There were concerns around the vaccine raised, people wanting questions answered around the vaccine, people wanting to know specific things around how the decision making of council and ministers takes place. But like I say, I think overall it was a well balanced meeting, and I think it's a shame that perhaps some of the ways it's been portrayed is off the back of a 2-minute video clip, when actually the whole of the meeting wasn't like that.
Okay, let's talk about the medical director. This is coming up quite a bit about her views have not been represented enough, maybe, and you haven't taken them into account. I've asked also Dr. Hewitt on those press conferences exactly trying to pin her down. Now, you said she was on side when she wasn't there. When I finally got her, she went around the houses. The most fantastic political answer possibly ever.
Well, what I can say is the Director of Public Health sits in on the Council and Ministers meetings. Right. Hers is a statutory role. She hasn't expressed concerns about the decisions in that way. She hasn't opposed any of the decisions in Council and Ministers that have been taken. In relation to the Medical Director role, the Medical Director is one of many sources that actually feeds in. But as I've said before, the difficulty with council and ministers is we've got to balance off the medical against the economic, against the social aspects as well. And that is a fine balancing act. Sometimes that decision comes down in line with what the medical director is suggesting. Sometimes it might be a hybrid model of a mix, and sometimes it might not. But we have to take a wide-ranging view in council and ministers of a multitude of different opinions, and also from the fact that sometimes the medical opinion and the public health opinion, because they're looking at two very different things, can actually be opposing views. So you've somehow got to balance the two off. It shouldn't be thought that the medical opinion or the public health opinion is always in sync.
You accept, though, when we have those press conferences, I ask a question like everybody else does, and we expect a real answer. Now, I said that I started that one, and we're talking about 2 press conferences ago. I was everyone on side, all them, and the Chief Minister said yes. Now, when we went a bit further, you did eventually say that no, it's not 100%.
Well, I clarified that because I think the Chief Minister took it as meaning public health, and there is the distinction between public health and the medics. Right. They are two very different things, so that's why I jumped in to actually clarify.
But I had to drill down
in
a bit,
relation to the medics.
So where exactly are we with this then? How much input is everyone going to get? I mean, is it all over now? Are we literally past all that business now with the emergency lot as well? And we are just going down this route of doing whatever you as council ministers decide. You don't need much other help from
we always bring in support, because it's important we still monitor the situation. Yes, we are living with COVID, but this is the most difficult phase, because living with COVID doesn't mean you do nothing. We still have the measures around the hospital, so we need to keep a monitor on where the hospital, where our health service is. We need to look at how much serious illness is coming off the back of anything that's happening in the community. At the moment, the cases appear to be starting to plateau, but we can't take that for granted, so we need to have public health input and medical input into that. We need to work out some form of modelling to see where potentially we may be going. So there is still an awful lot that needs to be fed in, and the emergency advisory group will play a part in that as well, with council and ministers referring things in for their opinions.
And there's one in ICU at the moment, I understand, with underlying health issues, as that's
correct.
Sort of thing. So otherwise there's what, 6, whatever was the other day? 8. That's just gone up again, hasn't it, slightly?
Yeah, that was the other day.
Yep.
Yeah.
Anything you can tell us, or any worries or concerns when you see those sort of numbers?
Not at the moment.
No.
Most of the patients that are in are receiving oxygen therapy, so it's very, very different to what sometimes you see on the TV of ventilation, everything else, and they require. We've seen that a lot of patients that are coming in are actually requiring less treatment than they did before. That's an effect of vaccination as well. We're seeing very similar to what the UK has seen, to be perfectly honest, which is patients are coming in, but their length of stay is actually less than it was previously. And of course, that's a good thing that people are being turned around and released back out.
Manx Care report that the hospital is under a lot of pressure, which would normally be seen in the winter. Can you give us any more light on that? Is that, again, related to staff off? This
is general pressures. So we are seeing, obviously, staff pressures, because there will be staff themselves that are in isolation with the current outbreak on the island. Also, Manx Care themselves, I think the other day, pointed out that there's been issues around people trying to be seen at a GP level, so that leads to hospital pressures. So they're working with the GPs to get extra resource at a GP level, so people aren't presenting to the hospital as their first point of call, but instead presenting to primary care. But these are general pressures that we are seeing. We have seen them in the past as well, in 2018, long before the pandemic, which seems a life away now, but we saw similar pressures around about the summer months, and there's been spikes in various other illnesses as well that people are seeing.
And lateral flow kits, I mean, I can't believe how much money is going out on how many. It's just, it seems like for a population our size, it's gone a bit strange. Now, something's gone amiss, hasn't it? People are hoarding, people are overusing them.
I think, unfortunately, in some circumstances, we are seeing a repeat of what was called last year the toilet roll and pasta effect.
It is that,
where some people are hoarding.
Right.
I would appeal to people not to hoard. There is absolutely no need to hoard lateral flows. Public health has been quite clear in the fact about and about testing twice a week for people, and that we shouldn't. There's no need for people to stock up on huge amounts of lateral flow. What you're doing by doing that is preventing other people who may be actually in greater need of accessing the tests not to be able to do so. We may have to look at some form of delivery system or record of who's picking them up and how many they're actually collecting if we have to.
I was going to get to that. I mean, at the minute you literally can walk in and then walk to the next one and keep going around.
But I do think that actually the hoarding is a small minority of people. I do have to emphasise that. I think actually the take-up is actually encouraging, that as a society throughout this entire pandemic period, the Manx public have been very personally responsible. And we have now put personal responsibility onto people to make a lot of their own decisions. And it's encouraging to see that people are willing to pick up the test kits and actually test themselves. Mm-hmm. It's a responsible thing to do. People are doing it. In a lot of other jurisdictions, particularly larger jurisdictions, you don't tend to see that level of testing.
It's double-edged though, isn't it? Because we're testing, if all those units being used, and then suddenly you see these sort of weird charts that put us near the top of, at the top of a particular grouping, because we've gone from 0 cases to thousands. That worries some people, obviously.
It's the problem when you're trying to do assessments. So, the case numbers per 100,000 people, where a small population, it's actually under 100,000. And this is one of the problems. It's similar to the R rate last year, if you remember, where we said the R rate isn't really effective in small populations, right, because it just spikes and then changes and just completely fluctuates. And it's similar with the cases per 100,000. If you get a large number of cases one day in a small island community, your number pushes you right up to the top of the league table, but then on other days, if you start getting smaller cases, you suddenly shoot back down. So it's not really an effective measure in small populations. It's mainly designed to look at large jurisdictions like the UK.
But we're testing a lot. I mean, ourselves are testing, and then we're also going up for a test of the grandstand. I mean, we are overdoing it. Do you think?
Well, that's one of the other things, because the more you test, the more you find, of course. So if you've got, say, 20,000 people on the island who've all got kits and are testing themselves, you're going to uncover cases that may be completely asymptomatic well in themselves. I've got friends who are exactly that. They test themselves, came back positive, but they're not ill in any way, shape or form. And you wouldn't have normally identified those cases. So it is encouraging, though, because of course by identifying cases you're breaking potentially onward transmission chains, but you do have to recognise that you are likely to inflate your case numbers compared potentially to other jurisdictions that test less.